We focus a lot on what we would call regenerative medicine, meaning we try to reverse some changes which have been caused by lack of oxygen in different organ systems, in particular the heart, the brain, even in other organ systems. And that causes chronic damage or acute damage, followed by chronic damage and subsequently the development of scar tissue. Scar tissue, as you know, is dead tissue. It's not functioning. It doesn't help the contraction of the heart muscle. So traditionally, the only way for us to replace scar tissue is to replace a whole organ, as we do if we do transplantations, heart transplantations. But there's only approximately 2,200 transplantations done per year in the United States. But there's more than 6.5 million patients suffering from chronic heart failure. So you see there is a large gap between the end-stage therapeutic options and the demand from the patient side. So as an alternative to a radical major surgery, which not everybody is a candidate for, meaning transplantation, the other topic is trying to use what we call regenerative medicine, as expressed as stem cell therapy, in order to try to restore contractile materials in the heart as well as in other organs. Several studies have been done worldwide in different countries, whether it's in Germany, in the United States, in Israel, all over the world, using different forms of stem cells in order to try to replace or regenerate damaged tissue, especially in the heart, making stem cells really the most promising adventure in modern cardiovascular medicine. So stem cell therapy is relatively new in the sense for what we are using it, meaning for regeneration. What we are talking about is an attempt to add an additional armamentarium to our standard therapies in patients with end-stage diseases. So how can we replace scar tissue? How can we try to improve a failing heart? So there is no way to really replace scar tissue unless, as I mentioned earlier, we replace a whole organ. So the idea using stem cells is basically using the omnipotency, if you wish, meaning the ability of stem cells to develop in different kind of tissues and to integrate within host tissue into the tissue, whatever is warranted, and by thus replacing scar tissue and contributing to the contractile function of that particular organ. We have enough scientific data as well as enough clinical, partly anecdotal, evidence showing improvements.
I would want everyone to know about this. And the more people, that's great. Just, we need people to know that stem cells is the way. It's the way, it's the future, and it's simple, easy, and it works.